Hi, I'm Dr. Elizabeth Paxton. I am the Chief Nursing Officer for Providence, Alaska. I have been with Providence for a little over 2 years and have been in nursing for 35 years. My clinical background is in neonatal nursing. My role is to ensure that the nurses for Providence, Alaska are practicing under one practice model and are using one single vision to ensure that our patients get the care that they need across the state of Alaska. So Providence's mission is to really care for the poor and vulnerable. And when people are sick and hurt, they become poor and vulnerable no matter who they are. And so Providence makes it our mission to care for those people. Providence also follows 5 values: compassion, integrity, dignity, excellence, and justice. And so all of the nominees that were voted for actually share those values, whether they work for Providence or not. Nursing itself is really centered on caring for the patient and ensuring justice, and it's always done with compassion. Nursing is important because it gives the opportunity for nurses to be with someone at the most vulnerable parts of their life, whether it's the happiest day because they've just had a baby, or the worst day of their life when a family member has died. And nurses get to be there to support the families and the patients. Nursing is also very varied. The voice of nursing, it's important that it is heard at the bedside all the way to the boardroom. Nurses are advocates and supporters and influencers to ensure that everyone in the community is well cared for. So nurses and other healthcare providers have been at the forefront of the pandemic, whether it's caring for patients as they die because their family members can't come, picking up extra shifts because we were short and we didn't have the nurses because nurses had called out sick because they had gotten COVID themselves. Nursing has been very much at the front lines. It has taken a toll on all healthcare professionals. The emotional drain, both mentally, physically, and spiritually, has been very hard for nurses and other healthcare professionals. And as employers, it's our job to ensure that our nurses are well taken care of. And so we are providing them support through different mental health programs, different support services to make sure that they are resilient and able to care for the patients of the future. So it was very exciting to see over 100 nominees around the state, and the 20 finalists were incredible. So their stories ranged everywhere from helping patients get through cancer treatments, and that story was actually nominated by a patient, which is incredible. That really helps us understand the care that the nurse provided, all the way to a nurse who influenced public policy both locally and at the state level to ensure that her community was safe and her community members were getting the care that they needed. It's very exciting to see these nurses and the care that they provide around the state, whether it's from Anchorage to very small rural communities. So on behalf of Providence, Alaska, I want to thank each and every nurse who was nominated, as well as every nurse in the state of Alaska for the care that they provide our communities. Nurses have been certainly the healthcare heroes in the past couple of years, but they can't do it without their colleagues. I do want to really encourage all the nurses in the state to be very proud of the work they've accomplished over the past 2 years and thank them for all their service. They truly are the heroes.